Hello everyone, I am Dr. Diron. Today I am going to talk about something related to the gluten. Gluten is a protein that we can see in the bread, some cereals and some sauce. There is something called gluten-related disease. Commonly the diseases are the celiac disease and gluten intolerance. When it comes to the celiac disease, it is one of the autoimmune disease. But when it comes to the gluten intolerance, it is not related to autoimmune, just purely related to gluten. In case of celiac disease or in case of gluten intolerance, the commonest presentation that we see is diarrhea, loose motion, weight loss and all. But there are some extra manifestations that we can see in case of celiac disease, arthritis problem, heart-related, brain-related problems. So what happening in case of celiac disease? Whenever we take gluten diet, our body will recognize or it triggers, this gluten will triggers an immune response, so that immune response will result in damage and destruction to the small intestine, especially the lining of the small intestine. That will leads to villus atrophy and all. So when you don't have a villi in a small intestine, there won't be no digestion, there won't be no absorption. Ultimately, the patients will develop diarrhea, weight loss and some energy, some malnutrition problem. So when it comes to gluten intolerance, there won't be any damage for the lining of the small intestine or intestine. Rather, there will be just loose motion, diarrhea, weight loss. So how can we diagnose this celiac disease as well as how can we diagnose this gluten intolerance? First of all, we have to exclude the celiac disease by doing some investigation, and we exclude the wheat allergy. And then if we don't find any clues for the celiac disease, then we can label this as a gluten intolerance. So the first of all, for the celiac disease, what are the commonest investigation that we do is we go for the endoscopy and we go for the immune study. When we go for the endoscopy, we will see or we will visualize the damaged small intestine, and we can take the biopsy as well as. When it go for the immunoassay, there will be antibodies known as the tissue transglutaminase antibodies. Those are the evidence of this is the celiac disease. When we don't find the evidence of these antibodies, evidence of the damage for the small intestine, then we can label this as a gluten intolerance. When it comes to the management wise is almost same. The dietary modification, gluten-free diet. That is a mainstay of management, and some other extra advices are there regarding fluid intake, regarding avoiding some stuffs. But in case of celiac disease, sometimes the extra management comes depend on its complication and an extra intestinal manifestation. So this is the difference between the celiac disease and gluten intolerance. And celiac disease is an autoimmune disorder, while the gluten intolerance is not. I hope this video is very helpful, and we'll see you in the next video. Thank you.